So let me show you, just to refresh you, how to enter the data into the AIM data portal. This is only someone can enter data if you have the role of hospital administrator. Anyone who's a hospital administrator can also invite other users, and I'm not seeing, there are a couple of hospitals that have invited other users, but most of you all have not. So I would encourage you to invite other users. They can be read-only users if you don't want them to be able to enter data or edit your data, so that they can just see where you are, but they won't be able to change anything in the data portal. And I'll show you here after I finish explaining these measures how you can invite other users. So I would encourage you to do that. Invite your nurses and doctors to be able to access the portal. So the first thing that you're supposed to be entering, and this has been in place since we started doing this in November, you can enter your structure measures. This is one of our Oklahoma hospitals, and we can see that they have entered 1, 2, 3, 4, 5 of these structure measures. They have added a function here, and we'd like for you to use it, because when what we see is a dashboard of all of the hospitals, and if a field was blank, we didn't know if you didn't have it in place or if you just hadn't gone to the site and enter it. So we would like you to enter either not in place or the date approximately of when you implemented this measure. So, for example, the hemorrhage structure measure 2. Does your hospital have an OB hemorrhage policy and procedure reviewed and updated in the last 2 to 3 years that provides a unit standard approach using a stage-based management plan with checklist, ensures availability to OB hemorrhage supplies at all times? And this hospital had that in place 2/15/2015. And if it wasn't in place, you just check that. Any of the structure measures, don't forget to save after you enter your information. So I would encourage each of you to go to the website and enter information about each of the structure measures, whether you enter a date or the not in place. These little warning signs here are just telling you that it's incomplete. You haven't entered that information. Next, let's look at our process measures. So this just became live on January 1st. We don't see that there are any hospitals that have entered process measures. In order for you to keep track of your hospital measures, your process measures, we have a data collection tool on our website, and I'll show you that here in a second. It's just called AIM Process Measures, AIM Data Measures Collection Tool, I think, or something. We'll look at that. That's a way for you to keep track in real time, and then you can enter the process measures quarterly. Your deadline is supposed to be 30 days after the end of the quarter. So the first quarter is quarter 4, 2015. So you have until the end of this month to enter your process measures. So let's look at hemorrhage first. And all you have to do is go through. So there's not a whole lot here. You have 5 process measures. And the first one is talking about the education. So what cumulative proportion of your providers have completed education on hemorrhage within the last 2 years that includes teaching on the hemorrhage bundle and the unit standard protocol. And then you have a drop-down menu to enter percentages in the 10% range for each. So this is pretty self-explanatory. What proportion of mothers had a hemorrhage risk assessment done at least once before birth? The fourth one, what proportion of mothers had formal measurement of cumulative blood loss, birth through recovery period, and how many drills were performed for any safety topic? And then you can check on what topics were covered in your drills for this quarter. And then don't forget to save your data. So those are the process measures for hemorrhage. And then we can also enter process measures for preeclampsia. And it asks about education. They're developing a education module, an e-module on preeclampsia, so that should be available within the next couple of months. But you're not required to use those education modules. So the first two ask about education. The third one asks about how many women had persistent new onset severe hypertension, and then it gives you a exclusion. Okay, so they like for you to use at least two systems for identification of denominator. So you could go to your pharmacy records and see what, or go to discharge data or something to see who had a record of diagnosis of hypertension. Or you could keep track on the data collection tool that we provided for you. So those are the two different ways that you're capturing these women. They just want to make sure none of them are missed. This third one is how many were treated within 1 hour. Of those women, how many were treated within 1 hour? And this, you could use your pharmacy records, but if you didn't get treatment, they wouldn't be included in there. So the other way, you could either search your medical records, your EMR, or you can use, again, the data collection tool that we provided. And then it asks, again, the same question about the drills that were performed. So that is the two process measures. This is a criteria for the stipend that those be entered. Quarter 4, 2015, when we check on March the 1st, you should have these process measures entered into the data portal. That's how we'll check. And we'll be sending you reminders to make sure that you're aware of that. The last one is measure results, and this is really your outcome measures. This was available last time. This is your hospital discharge data that is sent to the AIM data portal by the health department. They've now added at the bottom, you can see your process measures here. So for example, this one, there's nothing entered, so we do not have information here. And I'll show you at the top. I just want to emphasize something because I think it's pretty confusing and it's hard to remember. You know, we did a webinar back in November, and it's kind of hard to remember everything that we've explained about these measures. But one thing I want to emphasize about the outcome measures is, for example, let's look at severe maternal morbidity among all women. This is a graph that they just added, so you can compare yourself to all of the other hospitals and see where you rank. So this hospital is 30 out of 48. They also are shown by color, by what is your volume of births. So we think that that's helpful to you. If you ever forget what are the numerators, denominators, what are the definitions, this is a link. This AIM data collection plan is a link to the data tool. And then at the bottom, you can see what are the actual numbers that make up this graph. So you have a comparison graph, and let's see, can you see this quarterly? See if this changes. Yeah, that is just, I guess it does change for that last quarter. So we're going to check on, they just added this a couple of days ago. We're going to check on how you change the date that you're looking for, what data for what quarter or what year. So we'll be asking them about that. So this is the comparison graph. We think that that's going to be very helpful to you all. And the other way that these are shown is with our trends. So this is what we showed you at the last webinar. And This is in the quarterly view, which I think is the most helpful, and it just shows you here the dark blue. The big fat blue line is your hospital. Then you have your rate for life-size hospitals is the black line. The Oklahoma Collaborative Wide Rate is the light blue line. And then the 50th to 75th or 25th to 50th percentiles. And depending on whether this is a positive or a negative measure will govern which is on top for these, but just know that you want to be in the green. You don't want to be, this is kind of supposed to be red, the pink. So you want to be below, and this one you want to be in the green area. One thing that you all can do is when you are looking at your data points, I can't see it now because we have the hospital names masked, so you can't see who the hospital is, but you will be able to see the numerator and denominator for each data point. So that can be helpful when you're looking at this information. We have sent 2014 data to the data portal. There was an issue with a couple of the hospitals, so they're fixing that. So we should have 2014 data also available soon. So this is how you can see your trend lines in the by the year or quarterly. I think the quarterly is, at this point, that's the best way to view this. And then for the annual data, you can see based on race. So this can be very helpful. You can see this hospital definitely has a higher prevalence of severe maternal morbidity for African American women for these 2011 through 2013. This little blue triangle is where you can click it to save the graph, and so you could put it in a PowerPoint if you want to. This is just cautioning you that you're going to put this somewhere else, and you want to make sure that they want to make sure that you're aware that this is now sent over an insecure connection and could be read by a third party. So this is good information about your race data, and you can see the numbers here down underneath. You can also, this button here, to download it into an Excel file. So those are the information, that's what you can see on measure results. I want to explain one thing about the measure results. Again, if you want to look at all the information, you can go to the AIM data collection plan, and I'll go to that in just a second. But let me actually show it to you now. When we look at the AIM data collection plan, this you can access through the data portal, or you can access it through our website. This is just the overall, what are we looking at here, and want to reinforce something because I know it can be very confusing. When we're looking at the maternal morbidity, severe maternal morbidity, they're actually looking at ICD-9 codes. So in order to determine your numerator, there are 25 codes here. They either indicate that the woman received a blood transfusion or she has some kind of diagnosis code that indicates severe morbidity or admission to an intensive care unit. So the reason the hospital discharge data is used is because it's easy to access. All of your medical records are coded by coders. Your quality people send this information to the health department at least annually. So I think there are 17 hospitals that send it more frequently. We're going to be working with your quality people to ask them to send this more frequently, just so you can have more frequent feedback in the AIM data portal. So we'll be working with the Hospital Association on that, but you're not responsible for sending this data. It's all based on ICD-9, now ICD-10 codes, and this AIM data collection plan should be updated within the next couple of weeks, where they also have one with the ICD-10 codes. These are 25 measures that they're looking at. One of them is blood transfusion. In the ICD-9 and ICD-10, there is no indication as to how many units of blood the woman received. So if she received 1 or 30 units, she is going to receive the 99 code. So that's something I want you to remember here for a sec. We're not investigating how many units she received because that is not in the code. I think they thought it would be too burdensome to, you would have to document somewhere where the coders would know how many units of whatever this woman received to be able to code for different numbers of units. So many providers are not documenting that information easily for the patient, for the coders to find with the information they have. So let's go back up here to the definition of the hemorrhage measures. It's on page 4 here. And when you look at how they're defining severe maternal morbidity, let's look at this one here. I'm going to increase this so we can read it. So outcome measure 3 for hemorrhage, severe maternal morbidity. Let's look. Wait, now I lost my, okay. Severe maternal morbidity among hemorrhage cases. So when they say among hemorrhage cases, they're looking at their denominator. So women during their birth admission, excluding ectopics and miscarriages, and if you go down to the back, you can see how they would exclude those through their codes. And they either have an abruption previa or antepartum hemorrhage code, a 641 code. They have a transfusion code, a 99 code, without a sickle cell code. So these would not be women that are coming in with sickle cell receiving a transfusion, or the presence of a postpartum hemorrhage diagnosis code, one of the 666 codes. That's your denominator. So all women during their birth admission who had one of these codes here, and then the numerator is which one of these women had one of those 25 codes on that last page. Okay, so that's how they determine the severe maternal morbidity among hemorrhage cases. So if you have a woman that receives 1 unit of blood, she will be included. Now, we know that that doesn't necessarily define severe maternal morbidity, but there's no way with the hospital discharge data that we can obtain the number of units that she received. So that will be up to you in your hospital to see which women who receive transfusions, they're really wanting to look at 4 or more units of blood, PRBCs or whole blood. Okay? That is why the next unit measure, they take out the transfusion code in the numerator. The denominator is the same. So all of these women that have received one of these codes, and then they're looking in the numerator which women out of the 24 diagnoses on that last page. So they took out the transfusion, so now there's only 24. So back to our AIM data portal, and this is where that comes in. So this is the severe maternal morbidity among all women, so this is all 25 codes, and then the severe maternal morbidity excluding transfusion codes, so this is only with the 24 codes in the numerator. That's the difference on these, so you can really see how your transfusion is driving your severe morbidity. If you have a 0 over here, that means that the only reason you had women in up here is because they had a transfusion. So whenever you are looking at these outcome measures here and you have zeros in these columns, it's because they had a transfusion. And so they're not included when you're only looking at the 24 codes. And if you, I know you probably won't remember that, we are recording this webinar, so you can look at that or you can give us a call. I know it's kind of hard to explain to other people. So if you need questions answered, please feel free to call. So you can also see here the severe maternal morbidity among hemorrhage cases and where this hospital ranks, and then their trends, same information here that we showed you before. These do not have race-based information. That's only for the overall severe maternal morbidity. So those are when we go to the measures, you are supposed to be entering your structure measures and process measures. Your measure results or outcome measures are determined by the hospital discharge data that's sent to the health department. So I think that is all I have. Let's open it up for questions.
Hey, Barbara, this is Christy. Can you hear me?
Yes.
Okay, so the coders will be getting all of that information about the morbidities and the mortalities and all of that and sending it to you, or do we need to get that from the coders and get that to you?
No,
is it something that now?
They don't.
Go ahead.
I'm sorry. They don't need to do anything special. The information in the measure results, outcome measure, is taken from hospital discharge data that is sent to the health department annually. So your hospital has already sent that.
Okay, I was getting really stressed there for a second.
Oh.
And then I think did you have a tool like a data collection tool for us to use on all of those patients that were delivered or whatever?
Yeah,
that we just typed
in. Let's go back to that. That's on our website here. We're sharing our screen again. So here's this is from the AIM tab. It's the AIM Process Measures Data Collection Tool. So let me show you this. You need to come up here and click Enable Editing, and then the first page, you'll see the tabs down here in the lower left. This is a paper for you to print off, and if you want to use this like on a board and have charge nurses or whatever this data on a paper tool, and then you could gather the information that way. This is something you print and then enter information that has on the electronic version what is the actual measure. Then if you go down to the bottom, you'll see digital. So this is a spreadsheet that you can use to enter data to this. So in this tool, you can also, again, see the different definitions when you hover over that field, and then you would remove these. These are just entered as an example, and you can use this to collect the information also. Is there anything you wanted to add, Denise?
Yeah, I'll just add that if you, like the X equals a yes, so for instance here, patient 1 had a risk assessment performed but did not have quantitative blood loss measured, had severe hypertension but did not receive treatment within the first hour. And so if you complete this for every patient, then it'll give you the percentage of patients that meet that process measure. So here's the percentage that meet measure 4 and process measure 5. And these two columns, this would create your denominator and your numerator for process measure for severe hypertension. And I'll just emphasize that this tool is really just to assist you in collecting the data. This is completely optional for you to fill out. You do not in any way have to complete this and send it back to us. This is just something we created in case you wanted some kind of a log or a tool to collect the data that you're going to enter on the AIM data portal under the process measures area.
There's also a tab for you to keep track of your unit drills, and then the last one has a link to the AIM data collection plan. So this we went over on the call that we had in November. That call is recorded, and you can access that through our website here. If you want to go back and hear that, the information in quarter 4 of 2015, we know that since this is the first data period for which we're collecting data, it may not be the best data that we receive. We definitely understand, and you all can relate, like with Every Week Counts, how we got a lot better with our data collection as the collaborative progressed, and I'm sure that will happen here. Some of you may have all of this information for October, November, December 2015. Some of you may not. So enter what you have, please. And if you have any questions on anything, please feel free to reach out and ask, and we can help you with that. So that's where that data collection tool is. This is a link to the plan. That's the different definitions that I was just talking about. Does that help you, Christy?
Yes.
Okay. So again, just to emphasize, you all do not have to do anything regarding the hospital discharge data. I mentioned we would like them to send it more frequently. We're not going to be working with you on that. We're going to be working with the quality department and who submits that information to the health department. So you don't need to worry about it. When you go on to your administration tools, you'll be able to see here, it says invite new user, and then you'll just fill out the information in that page. So we would encourage you to invite nurses, doctors, whoever you want to have access to your data for your hospital. We have access. We can see everything, and this is our Oklahoma dashboard, so I can tell you that we're shooting and you all have these numbers when you're looking in how your hospital compares to the Oklahoma collaborative-wide, but you can see we're running around, probably between 2 and 2.5%. That's on the high side. We'd like to get down more to 1.5 on our overall severe maternal morbidity for all delivering women. As we're moving through the work on our collaborative. So before we conclude, any more questions? Wouldn't it be great if by 2018, that's the whole goal of AIM, is to reduce severe maternal morbidity by 100,000 women. So if we could really shoot for decreasing those percentages there, that means that we have more women that are going home with their babies and hopefully then having healthy Oklahomans. So we appreciate all of your work that you all are doing to decrease maternal mortality and severe maternal morbidity.